Let's have a little review of articulations now that we're done with them from lecture. In the world of articulations, we looked at a few things. We looked first at classifications, then at actions, then at specific articulations. Those joints in the body that are most commonly injured. With structural classifications, we found that there's three categories. There's fibrous, cartilaginous, and synovial. If the tissue between the joints, or between the bones in this joint, is of a fibrous connective tissue nature, then it's obviously a fibrous joint. If the tissue between the two articular surfaces is cartilage, it's a cartilaginous joint. And if there's a fluid-filled space between the articular surfaces, that's synovial. In the world of fibrous, we have three categories. We looked at sutures in the skull in lecture and in lab. A suture is fairly immovable, and even though it's fibrous, don't think of it like it's a ligament there. There's a special structure, a special fibrous tissue that binds the bones together. If you have a tooth in a socket, there is a ligament that holds that tooth in place, and that would be a gomphosis. And lastly, if you have a ligament that's holding bones together, that's a syndesmosis. An example of that one was between the tibia and the fibula. Then we moved on to cartilaginous. A synchondrosis is between the epiphysis and diaphysis. It's also between that first rib and the manubrium of the sternum. They are immovable. The second ones we looked at were symphysis. A symphysis is a pad of cartilage between the structures, and it might be slightly movable. There are a couple of examples. One was in lab, which is between the two coxal bones at the pubis. The other from lecture is between bodies of vertebra. And the last category was the fluid-filled space. Those are the synovials, incredibly flexible, and because of that, they have to have a lot of structures. You should pause the slide in a moment, go through all of these, and recall what specific articulations fell into each category and why. With the synovials, you should review all the structures. In fact, you should even diagram out a stereotypical synovial joint. Remember, synovials have synovial membranes, articular and fibrous capsules, and reinforcing ligaments. Should also remember what the serous fluid is, what structure secretes it, and why it's important to the function of that joint. After we looked at structure, then you can look at functional classifications. How movable are these two bones? If the two bones in the articulation do not move at all, that's a synarthrosis, and sutures fall into that category. If the bones move a little bit, that's amphiarthroses, and some of the symphyses fall into that category. If the bones in the articulation move freely, that's diarthroses, and those are definitely synovial joints. So again, you should pause, review what the words mean, and which articulations fall into each category and why. Then we moved on to movement, and literally, I had you moving in the room. There were different categories of movement. There's gliding, there's angular, there's rotation, and then there's special. Gliding occurs when you have two flat surfaces moving against each other. This would be between carpals and between tarsals. Angular includes flexion and extension and hyperextension. Flexion is when you make a smaller angle with the two bones in the joint. Extension is when you make a bigger angle. Hyperextension means to go past the point of the angle. You can flex and extend a tremendous number of articulations. There's hyperextension of the head and the torso. Abduction and adduction are also angular. Abduction is to take something away from the midline. Adduction means to bring it toward the midline. Circumduction is a rotation. Circumduction means a cone in space, and it's a combination of all of the above. Keeping on the rotation is rotation. That's turning something on the axis. And for each of these movements we've talked about so far, you should be able to go back, think about body parts and articulations that do each movement, and now that you've had lab, you should even be able to add on to that the articular structures that allow that joint to do that movement. For example, what two bones allow you to rotate your head? What two bones in specific structures allow you to flex and extend your head? Then we moved on to special movements. These are ones that don't fall into other categories. They are their own thing. For example, inversion and eversion of the foot. Supination and pronation of the forearm. Remember, hold a cup of soup, pour it out. Protraction and retraction of the mandible. Elevation and depression of the mandible. And opposition. Just like in the previous slide, you should be able to stop the slide, pause it, go through each of those motions, think of a body part or articulation that does the action, and in many cases, the articular surfaces and structures that accomplish the action. Then we had a crash course in form follows function. We looked at a lot of different diagrams of a lot of different types of joints and how the shape of those articular surfaces allow that joint to have a given action. We're not going to go through them again. They're all in your lecture notes and your PowerPoints. You should definitely go through them. You should know the condyloid from the hinge joints and understand why that particular shape gives a particular action. And then we wrapped it up by looking at major joints. We looked at the knee in detail. You should pause it, go through all the structures, and remember on this slide there's even a few that don't appear, but they did appear in lecture and lab. We looked at the glenohumeral. Again, you should pause that slide, contemplate the structures. In lab we talked about that participate in the articulation and why it's a fairly easy joint to dislocate. We looked at the elbow again, pause the slide, mentally review all of the articular structures as related in lab and the actions. Same for a hip. Pause the slide, go through all the articular surfaces and the action. Same for temporomandibular. Pause the slide, go through all the articular structures. That's it for this particular review. It's a pretty quick one. Make sure you double check what we've talked about against your objectives in your lecture notes. Take tons of practice tests, and you can never review enough.